unit specification across, just to quickly refresh. So let me just bring this over and switch you for a second to the unit specification. We've been obviously discussing and studying this particular unit, which is person-centered approach. So in the first learning outcome of this unit, we understood what are person-centered values, the 8 values that we discussed of, anybody remembers? Independence, dignity, respect, empathy. So the first, few learning outcomes that we discussed, in the first learning outcome, the assessment criteria involved we going through the person-centered values. And these person-centered values, typically included things like individuality, rights, choice, privacy, independence, dignity, respect. And then we also looked at, partnership and equal opportunities. Now, we also discussed along with this, how this approach was developed. So we looked at the history and the beginnings of, how the Dr. Carl Rogers, the American psychologist, which started this study in the early 60s, later on adopted by the American Medical Association in the early 2000s, came into the NHS, and the Lord Darzai's report then, kind of formalized and finalized this to be able to get into, the NHS for the purposes of providing integrated care to our patients or to members of public. We also looked at understanding what are the challenges. So we looked at a number of challenges that, that can be encountered when we are dealing or, trying to implement person-centered care. And these challenges typically included cultural differences, beliefs, values, looking at, how we take into account patients, rights, and obviously their preferences. And then we discussed some of the challenges, which basically included challenges like communication, challenges which include training and development. And then we looked at, some of the challenges which primarily come across when we look at implementing this approach with requirements to meeting the person's individual's preferences, rights, and needs, so that the care being provided is meeting and, obviously bringing the benefits in terms of helping the patient get better. Now, in the second learning outcome, we went into understanding the rules and regulations which are around, legislation and regulation, which is around person-centered approach. We looked at 3 main concepts, if you recall. First was equality, second was diversity, and the third concept we discussed was discrimination. Now, the whole learning outcome 2 was focused around understanding the key legislations which are around these 3 main concepts which are applied when we are providing care to patients within the health and social care sector, within the National Health Service, whether it's an elderly age home, elderly home, whether it's a nursing home, care home, hospital, surgery, community center, or social workers providing care to patients or, people within their houses. Through local authorities, coordination with local authorities. So we looked at understanding equality, diversity, what does it mean in the context of person-centered approach? That means we're looking at treating everyone fairly. Diversity is we value the differences in culture, lifestyle, and beliefs which people have, and we make sure that we are not judgmental in that when we try and provide care. And the third part was discrimination, which is to look at understanding the Equalities Act, so that there is no way that any sort of discrimination can be applied, when care is being provided. Now, when we looked at some of the assessment criteria, we also went into the key legislations like the Equality Act, the Human Rights Act, the Mental Capacity Act. We looked at the Health and Social Care Act of 2010, the Care Act of 2014, and these acts, Safeguarding Act, these acts then make us aware of what the role of equality, diversity, and discrimination is in helping to promote person-centered care. In the third learning outcome today, we are looking at studying person-centered care. How is it applied? So we understood the principles, we understood the values, we understood what are the key acts and legislation. Today, we are looking at focusing on understanding what are the key skills, and obviously qualities required for you to work as a professional within the health and social care sector, and then use person-centered care and person-centered approach to be able to provide this to the patients who are coming in, to basically receive treatment within any sort of a setup within the within the National Health Service. So there are 4 assessment criteria. We are going to look at 3.1, 2, and 3. One of them talks about understanding your personal skills and abilities and qualities. That is where we will look at doing an audit of your personal skills. So there's a format that I'm going to try and provide, and this audit skills format will essentially allow you to audit your skills in terms of understanding what values do you have, or what kind of let's say what is your knowledge on the person-centered values, and how do you go about implementing these values when you provide or when you work within the health and social care sector, and how do you relate it to providing care to the individual. The second one talks about explain how health and social care worker can actually promote individuals' independence when providing, care. And the third is describing a situation wherein, as a health and social care worker, you will give an example of how you would ensure that individuals' privacy and dignity is maintained. And then the merit assessment criteria talks about any ethical issues that could be involved in dealing and providing person-centered care approach to the patient when they are receiving treatment from within a setup, and you work as a health and social care worker. So what we'll do is we will look at switching over to something as a activity first, simply because this is a handout which I'm going to share with you on WhatsApp. This is a document. I hope you're able to see my screen and hear me okay?
Yes.
Okay, that's great. So when we look at this particular handout, that you're looking at in particular, this particular handout talks about, you having to understand and do an analysis to show what is your understanding on person-centered values. So I'm going to send this across on WhatsApp as well as we talk. And the reason I would want to do that at some stages after the session, you should be in a position primarily to be able to fill this document up. And this document would basically, help you understand what are your qualities and personal skills that you can bring across, when you are working as a health and social care worker within the setup, and how do you relate your skills and, obviously your abilities to be able to provide person-centered care. So this particular bit that we look at is important. So basically, it's a Word document that I've shared here. We are going to discuss this in a bit of detail, but I'm just showing you the document right now. What you're going to do is, obviously, when you write in this document, so the document will expand on its own. So basically what you do is, when you start writing, what you could do is you could start pressing enter, and this would then expand into what do you think, what do you think is the definition of individuality? So you need to write it in your own words. How would you put this into practice? And that is what will be the idea of doing this particular activity or exercise, which will help you at the end of it understand the skills and qualities which are needed to work as a health and social care professional within the within the National Health Service or within a particular type of setup. So this document will also then at the end of it become a part of your assignment, because this would help you understand and accomplish task 3.1. So if I label this as 3.1, this would essentially be directly relating to your task 3.1 that you would do at some stage in your assignment. Now, this is just to show you that this is something that we'll have to look at, but let's get into an understanding of how do we look at, how do we get to this stage? So let's discuss this. We will go into a detail, offline when you try and fill this document up. But for now, what I want to be able to do essentially is look at the option of discussing in detail the learning outcome 3 and its indicative content. And we will do so by the use of PowerPoint presentation slides. Now, one of the first things that we want to understand when you want to do an audit and you want to look at, doing an audit from a point of view of, understanding your own personal skills and abilities that you're going to be using, to help then provide any sort of care, within a particular setting. If you work within a particular health and social care setting, like a care home, then essentially how and what are the qualities needed to work as a healthcare professional. So when we look at this, what we want to be able to do is understand your own personal qualities. So what could be your personal qualities? Your personal qualities could be things like your communication skills. It could be your skills which are related to empathy, your ability to be able to respect the individual, understand the individual from their viewpoint, and then look at your qualities would also include things like your, think of your qualities right now. So while I'm talking, think of your qualities that you would be bringing across to your place of work. So for example, things like when we say honesty, I am kind, I show respect, or if I show, say for example, empathy, or if I'm willing to support and take initiatives, these are all your qualities that you bring to your place of work. So when you're working as a health and social care professional and you think of your own qualities which are related to your personality, which will help you develop a relationship with the individual or the patient who's undergoing care, then in those cases, these are going to be skills and qualities required for you to provide care adequately within the health and social care setup. Sometimes we also say that I have problems solving skills. Sometimes you also say one of my qualities that I can work independently. Sometimes you also say, when you think of things like, given a task, I can take it from start to completion. I sometimes also say that I need minimum supervision to be able to perform any sort of a task. These are all your qualities that you are going to have as a person. Now, when we think of these qualities in general, what we need to do is keep in mind and relate them to the person-centered values that we studied, the 8 person-centered values that we studied. We have to keep and relate our qualities to those person-centered values. Those person-centered values include the first thing that we studied in this unit: individuality, independence, if you remember that, privacy. We also studied choice, dignity, respect, rights of the individual, and then being compassionate. Now these, and along with that, we also looked at partnership, and we also looked at, basically respecting the rights of the individual. Now these skills, or essentially person-centered values, not skills, I would say person-centered values, which are required by an individual. And then if you map them with your personal qualities, you would be looking at coming out with a table, which I showed you earlier as a Word document, and they would help you understand what other person-centered skills you need, because what we are trying to do is do a mapping of my personal qualities with person-centered values. And those two together will help me understand the qualities that I need to be able to build relationship with individuals to which I am providing care in a particular setup. So if you work within the National Health Service or NHS and you're working as a healthcare worker or a healthcare assistant, you would have certain qualities like I have dignity. Or so, for example, qualities like your own personality or your own personal qualities like time management. You would have qualities like you're able to respect, you're able to work independently, you're supportive, you're compassionate, you're honest. These are your personal qualities. And then I relate them to the person-centered values, which are things like dignity. You're able to, give person respect. You mutually respect the individual. You give, information so that the individual can make independent decisions. You're respecting their rights and, their individuality. They would then help you work well within a particular setup. And that is what is the essence of understanding this particular learning outcome. So in addition to this, what we will also see is that communication skills and our ability to be able to be, understanding the culture and environment that we work in, problem solving skills, trustworthiness or reliability, honesty would help you build what is called positive relationships with the patient. And this would mean that the patients can rely on you, they can trust you, and they have confidence on you, and the care that you will provide would then be useful and meaningful for the person to help them get back on their feet or help them get better. So when we talk about your personal qualities and person-centered values, we need to be able to find a match in the middle, and they would help you with what are called building positive relationships with the patient. That means you're going to be able to have meaningful interactions. You will be able to understand the patient well. able to understand their requirements. You'll be able to respect their rights. You'll be able to give them information which allows them to make independent decisions. And this would make them feel more involved in the essence that the care that you're providing. They will feel more involved in that particular process. And it will be overall beneficial both for the setup, for the individual, and also for the person who's providing that care. Now, if I throw health environment into it, that means a lot of different practitioners. When I say practitioners, by now you should be able to understand what do I mean by practitioners. Practitioners would mean you have nurses, doctors, healthcare assistant, healthcare workers. You have lots of different types of people like physiotherapists, nutritionists, occupational therapists, people who are working as a team to provide care to an individual within a particular setup, like a hospital. So when I say use the word practitioners, what I mean by that is all the people who are involved in providing care to some sort of a care to the individual patient. Now, practitioners and organizations that can provide diagnostic, preventative, remedial, and therapeutic services in different settings would constitute what is called health environment. That means a hospital would be such environment. A GP surgery would be such an environment. You have pharmacy, which is such an environment. You talk about a community center wherein people go to receive physiotherapy. That is an environment. So these are all setups which are primarily having practitioners who work within them, and they provide different kind of services to individuals in need. And these services help the individuals or the patients to get better. And then we talk about social care environment. That means environment in which social care providers, practitioners, professionals, social care workers in general will be looking at providing care to the individual. So when we work through local authorities, when we look at housing, providing community nursing support to individuals who have, say, for example, somebody who's had a bypass surgery, and they get discharged from the hospital at some stage because they've had a major surgery, which is a bypass surgery. When they are released, they go home, and they would still need regular visits from the community nurse, from the social care worker, to be able to look after them and obviously provide medication or review their medication and help them do their daily chores or their functions. So in such cases, when care is being provided within a particular setup, which is like a social environment, like the home, or in some cases, council housing, in some cases, care centers, where vulnerable people or people who are vulnerable can also be protected, and the council or the state essentially provides protection, then in those cases, those environments are going to be called social care environments. So here you could be dealing with young people, children, people who are vulnerable to any sort of abuse or discrimination or any sort of neglect, and that could be financial, sexual, it could be verbal. Then in those cases, the people who are providing care in this particular environment, which is like a social care environment, so that they don't get disadvantaged, would be essentially looking at also contributing towards, providing services. And that is where we differentiate between health environment, which is basically when you are working within a hospital or a GP surgery or a pharmacy or a community care center or a physiotherapeutic center. Those are going to be places where people go and receive treatment. But in the social care environment, people are looked after within their own environment, and it could be within a foster home, within a council housing, within their own homes, within, for example, educational setups like nurseries and things like that. They would then be classed as what are called social care environments. Now, when we look at child care environment and we look at working in partnership, these are concepts that we need to understand, because in this learning outcome, we need to be able to apply person-centered care in different healthcare settings. So what we are discussing here are essentially healthcare settings. So when we talk about healthcare settings, or let me put it this way, health and social care settings, these are settings that will be useful where person-centered care can be applied. So when we talk about childcare environment would be places wherein you look at nurseries, you look at kindergarten or schools, essentially when children are basically studying or obviously are in an environment wherein they are receiving either education or in a preschool setting. they would also be activity clubs, for example. They would also be termed as, childcare environments. So imagine if you are working and you're a working parent, you have to drop your kid off, to a nursery in the morning before you go to work. That nursery would constitute what is called a childcare environment. If you have put your children into an after-school club or an activity club, that would mean after your school, because your work finishes at 5:30, your children will go into an after-school club after 3, or after when the school closes at 3 p.m. or 3:30. Between 3:30 and 5:30, they are in an after-school club, and that would also constitute what is called a childcare environment. When you are looking at creches, nurseries, after-school clubs, activity clubs, or essentially places where children would be required to be taken care of by professionals. When I say professional, I could also say practitioners. They would be, or children who are receiving care, under people who are qualified as childcare, and they are primarily child carers, or they are in early education. Then early education practitioners, EYE as we call them, they would constitute a childcare environment. Then when we look at healthcare settings, sometimes you would also look at these settings being, working in partnership. That means private-public partnerships will be there between the NHS and private providers. Here, sometimes you would see, I don't know in terms of, if you've seen private agencies which work within the NHS and provide care. So sometimes you would see that there are private agencies like Sohodex, SOHODEX. So this is an agency which provides, some sort of services within the NHS, which it could be porter service, it could be, for example, outsourced manpower service in terms, and this would be Sodexo. In some cases, these services which are provided primarily by private players in helping to run, the setups would essentially be partnerships which NHS or the healthcare sector has formed with carers, with providers, with contractors, and they would also be looking at providing and delivering services to people within the context of delivering care. And this care has to be person-centered care. So what we will look at is also take this into account as one of the settings where you would see working in partnership, and healthcare environment, or social care environment, or childcare environment, and positive relationships would be required basis the personal qualities and attributes that you have to be able to deliver person-centered care to people within a setup. Now, in order to emphasize this point of why person-centered care is very important, let's look at a video which I've got, and this video would highlight why person-centered care is important, specifically when we look at various types of healthcare setups. So let me switch over to a video. So this video is basically created by the Social Care Institute of Excellence, or SKY, and I've chosen this video because it talks about personalization, which is one of the key characteristics of providing person-centered care. We need to be able to take into account what is called the preferences, rights, beliefs, values of the patient, to be able to then provide care which is bespoke and meeting the requirements of that individual. So let's look at listening into this video.
All of us at some point in our lives will rely on social care, be it for ourselves or for someone we care about. Personalization ensures that the recipients of support remain central to and in control of the process by which they receive it, so that they can live the life they want to live. One way this can be done is by giving people who use social care the choice and control to become active rather than passive recipients, empowering people to design support packages for themselves or to choose where they want to live. It's about more than just controlling how money is spent. It's about being supported in staying well and recovering quickly from illness. It's about ensuring that everyone has access to public services, from transport and leisure to advice and advocacy. And it's about strengthening communities by encouraging inclusion and supporting the relationships that are as vital to the care system as they are to society itself.
Personalisation means for me that I want to be able to stay living in my own home. I want to be able to access every kind of public transport. I guess it's really about the ordinary, to be honest. It's about the things that everybody, not everybody, but people choose to do, and what I choose to do is not very different from other people. Thank you very much. Thanks.
If I had to sum up what personal budget's done for us, it's united us. It's kept us together as a family. We were at the point of Hannah going into residential care, not because we wanted it to happen, but because it was the only way we were going to be able to function as a family. Being able to allow Hannah to develop as a person, go out on her own, have her own life, it's given me my life back.
Personalisation is about something that when you're well, you don't need to worry about. You're able to dictate that that's the way people treat you when you go into a shop, when you go into a bar, when you meet your friends, when you're having a meal with your family.
At the heart of personalisation is a recognition of the skill and creativity of social care practitioners. With systems designed to make the most of their people skills, they can get back to the reasons they wanted to do the job in the first place, not to fix people's problems, but to empower and enable people to fix them for themselves. Achieving this is no small task. It requires a change of culture, a shift of mindset, a different way of looking at the system. It means empowering social care staff so that they in turn can empower social care users. If we succeed, then everyone will benefit by being part of stronger communities and a more inclusive society.
Personalisation to me is about enabling me to do the things that I took for granted for so long. It's only recognising something essential in human life, which is that everyone is an individual, like it or not.
So this is one video that you get to see, which is about personalization. Let me also play one other video, which we are going to see at a bit of a later stage. But what I want to do is show it now so that we can go through the slides in a bit more detail. So this video talks about promoting independence in care homes. So let's listen in.
Oh, let me take that. What we'd agreed, remember? You were going to wait till the staff came in before you came down.
Karen, we don't lock the kitchen. The night staff need to get in there.
Oh, well, if you say so, Frank. Just trying to make sure Emily doesn't burn the place down.
See you again.
Yep, they had time this week. The staff are busy trying to get everyone up, and she's, well, oh, she's seen the place this morning. We all know electricity and water don't mix.
You can't just lock her out.
Yeah, but surely we're here to make sure everyone's safe.
I'm running a prison here, Karen. I'm running a home. When you're at home, you should at least be able to make yourself a cup of tea.
Yeah, but not if...
I'll have a word. See if I can sort it out.
Well, good luck with that.
Got a minute, Emily?
I suppose so.
Anything interesting?
Not the brightest in the village.
Sorry, Emily, I've never been much good at crosswords.
I might be getting a bit forgetful of the old age, but the old brain can still work out a clue or two. But you didn't come here to talk about crossword puzzles, did you?
No. It's this tea situation.
I like a nice cup of tea in the morning.
I'm sure you do, Emily. Usually the residents wait until the kitchen staff come in and then...
I've always made me a
Okay. Here, we like to try and make sure...
idiot,
Beg your pardon?
not the brightest in the village. Idiot. Okay. Okay. Oh. See? Idiot. Human boats in celestial body.
Oh, I'll see you later, Emily.
Meteor.
I agree. This is absolutely a case of health and safety. And whilst Emily is central to this, we also need to consider all the staff and residents here. You'll see on file that she has shown slight signs of dementia. And let's face it, she is 94. So the stage 1 criteria for the capacity test have already been met. In which case we move on to stage 2. And given Karen's observations, I really don't think
That's
Emily
right.
will be able...
I know it's me that starts this whole thing off, but I was wondering whether there might be a way.
By the way, capacity assessment standard procedure planning, stage and observations. We have to conclude that we can't allow to keep making tea for stuff.
Well, I think there is another way. I rang Emily's niece this afternoon. What? Consulting family is standard procedure too, isn't it, Frank?
Okay.
And niece told me that this tea thing has become a bit of a ritual. Apparently it all started when her husband Charlie was alive. She'd get up every morning, make a cup of tea, then take it to him in bed. Then they'd sit and talk about everything over the cup of tea. Then when Charlie died, she just carried on. Well, it seems to me that for Emily, the cup of tea isn't just a cup of tea. It's holding on to a memory of what her life once was. I'm sorry, Frank, I'm not trying to step on your toes here.
I know. It's easy to lose perspective sometimes. Even over a cup of tea. What do you think, George?
Well, as far as I'm concerned, if we can work out a best interest scenario which will keep everybody happy, avoid assets with fine, then I'll support you.
Good morning, Emily. How are you?
Here's Charlie.
So as you can see, what has happened in this particular video is that, we've discussed two aspects of, person-centered care, and obviously looked at examples of how independence and personalization can be supported, to help patients or people deal with and do their daily course themselves. So we looked at an example of, understanding how, in this case, Emily looks at dealing with, making tea, and why is it related to his husband, Charlie. And obviously this was treated as a bit of a ritual. And then previously in the video, we looked at how, people with a bit of a disability would want to carry on with their personal life. And just like any other individual, they would like to carry on and do their work. So essentially, they're not asking for, any sort of special treatment, but what they're expecting is that they also be treated and given the basic, requirements to be able to live, a healthy life. So with this aspect in mind, what we need to be able to look at is bring the 8 values that we discussed about person-centered care in the first learning outcome, which was we looked at personalization, and we looked at a bit of independence. But there are other values like privacy, choice, dignity, respect, partnership, and rights and individuality, which tends to be important when we are trying to provide care using the person-centered care approach. Now, with this understanding, let's nicely get into the assessment criteria which are there to discuss in the third learning outcome. So the first one talks about personal skills and qualities needed to help develop relationship with individuals in a health and social care setting. Now, there are lots of different things that we can bring into this particular assessment criteria. Now, we remember we talked about personal skills, things like time management, hardworking, able to work with others, show compassion, respect, independent decision making, working on your own, honesty, reliability. These are all personal qualities. Now, when you mix and match them with the person-centered skills which are required, what we need to be able to do is draw up something called, the understanding of what skills are required for us to be able to help use these qualities that we have while providing care. Now, one of the key things that you will come across would be communication skills. Now, it is important for us to be able to have good communication skills, because if you understand the other individual, if you need to respect and give the other individuals that you are dealing with choice and independence to be able to make their own decisions, your communication skills have to be good. You should be able to understand the other individual. You should be able to say the right things. And this bit allows you to build what is called positive relationships. So when we looked at the the healthcare settings, various different healthcare settings, we also talked about that we need to be able to form positive relationships which are going to help us have meaningful interactions. And these meaningful interactions would essentially be done through the route of communication first. And this communication, this technique or this skill that you employ in dealing with the individual, with the patient, and then helping understand them and their perspective would help you develop a positive relationship with that individual. Now, in addition to this, when we talk about communication, we also talk about the 6 C's of communication, which can be related primarily to, the health and social care environment or setting. Now, when we talk about the 6 C's of communication, we look at this from an aspect of the ones which have been highlighted in the table, and they include care, compassion, competence, communication, courage, and commitment. Let's take one example to understand why they are important from a point of view of, person-centered values. Now, if we talk about person-centered values, we look at one of the key things which comes across, in the person-centered values is the value of compassion. Now, if I look at the 6 C's of communication, there is a C which matches that, and that is compassion, and that is to make yourself aware of the needs of others and how do you help them fulfill those needs by carefully considering their rights, by respecting them, and allowing them to get information from you to be able to make an informed choice. And this would all be related to what is called compassion. So when we look at the 6 C's and put them into practice, and an example given here is the National Strategy for Nurses and Midwives and Care Staff, which was, launched in December 2012. It basically took into account failings in which were discovered by CQC in Mid Staffordshire Hospital, and Winterbourne report was published. And this report basically published that people who were having disabilities related to autism did not receive proper care because one of the 6 C's, which is compassion, was missing, and was not in the equation when care was being provided by health and social care workers, by practitioners within that setup. And systematic, negligence of this particular aspect of compassionate care led to the fact that there were a number of failings which were discovered in the hospital. So it is very important when you work as a health and social care professional to have this 6 C's as 6 C's in terms of your personal attributes or qualities, which are required to then provide care to patients who are receiving, or patients who are receiving, care or care services from you. So one of the important skills and personal qualities that we will need to look at is basically going to be communication. Now, when we talk about communication, communication can be of different types. As a process, it has 5 components. And I think a lot of you know, when you've studied the communication unit, communication is a process because you say something, on the other side, the receiver is receiving that information, then you give some feedback. In between, there is, encoding with when you're using technology to send communication like we're doing through the medium of Zoom meeting, and then you're receiving it at your end, which is being uncoded, and then you receive the message. So this process, of communication is of various different types. There is active listening and there is passive listening. So when we talk about communication in terms of active listening, one of the qualities which carers are required to have is the patience, quality of patience and quality of listening. You should be able to listen to people. Sometimes when we say, the person provided a patient ear, that means the person was all ears to listening, and it was all about the other person just talking and talking about their emotions, and this was overwhelming for the person who was just silently listening. So sometimes you are there because you're listening to the other person, you're listening to their views, and that helps them become calm and normal, and obviously get over a particular situation. So listening is a very important aspect when we look at communication, because if you know, communication consists of speaking, listening, reading, and writing as a process. So one of the most important components of communication tends to be listening. That means you're able to listen patiently to the individual, you are able to understand their viewpoint there, you are able to understand their perspective. And then if you look at gestures like yawning, crossing your hands, or looking away, or looking onto your phone, then this shows a bit of disrespect that you are not either interested in talking to the person, or you are essentially, getting bored. And that is where this process of listening becomes important, specifically for a person who works works within the health and social care sector, because you are able to pick up signs of distress, any sort of negativity, or any sort of areas which could be causes of concern, just by listening to the patient. Now, listening can be active, listening can be passive. Passive listening is when you're not participating, you're only listening and reacting to certain situations when asked for. Active listening is when you're participating in that conversation, you're commenting, you're understanding what the person is saying, and you're also appropriately commenting or responding back by providing more information, which would allow the individual to make a decision. So the process of listening tends to be important when we talk about communication as one of the skills. Now, sometimes we also see that the process of listening and responding go hand in hand along with the tone of voice. So when we look at the tone of voice, it is important for us to understand that when we talk to the individual, or when we are listening to the individual, we are going to be able to do so in a way which is going to make them feel important, valued, and their respect, their rights and values are respected. and their dignity is maintained. So it is important for the person working within the health and social care sector, as one of the personal qualities tends to be that you should be calm and you should be able to vary your tone depending on how you're providing the information. Sometimes you have to have a friendly tone. Sometimes you have to have a tone which is going to be, maybe if you're dealing with somebody who has a bit of a disability in terms of hearing, then you have to be loud enough to be able to make sure that your message is able to go across. So the tone of voice, when we talk about in general, when we say tone of voice could be, very important, because of the fact it allows you to understand the concerns. And also when you look at your tone of voice, when we are writing, sending something in writing as a written form of communication or as a spoken form of communication, then the tone of voice tends to be important, because you need to be able to have that conversation with the individual in a formal setting, in an informal setting, in a humorous way, to let the person know that this is something which is a lighter situation or a moment which you tend to enjoy or you can enjoy with. And in some cases your tone of voice has to have a serious tone, an optimistic tone, and in some cases it has to be a motivating tone, and in some cases it has to be an assertive tone. Now, just to give you an example, what will be an example of a motivating tone? Somebody who's had a bypass surgery and needs to get back onto their feet, the nurses, the healthcare assistants would normally motivate that person to basically start using the walker and walk as much as possible to help the blood circulation going, and obviously making them feel positive and motivated so that they are able to exercise enough to get off the bed. That could be a motivating tone when you talk to the person, like patient, like that. An assertive tone would be when you're looking at giving medicine or administering medicine. Now, if the patient refuses or gives a lame reason that this is not something I want to have, the taste is not good, this and that, your tone has to be assertive to say that if you don't take this medicine, you're not going to get better. If you don't take medication regularly and don't do your exercises regularly, that would mean that you'll be staying in the bed and you would not be discharged soon, as you're expecting to be discharged after the surgery. So in those cases, your tone of voice should be assertive, and it also needs to be firm, and that would also be a part and parcel of your communication. So when you look at talking just about one personal skill which is required to work effectively and have qualities that will allow you to build positive relationships within a health and social care setting, would include, say, communication. And communication can have so many different forms of connotations which you are going to be able to use, like tone of voice. You're going to be looking at the 6 C's of communication. You're looking at active listening, passive listening, and they would then allow you to build a positive relationship with the patient that you're trying to provide care for, and that would help the person gain confidence and depend on you and gain that confidence to be able to speak to you freely, and then in a way the care can be delivered in a more personalized and in a more friendly and obviously a more useful manner. Now, another aspect of it that we want to look at is that sometimes when we talk about qualities, one of the qualities within health and social care professionals tend to be people skills, that they are able to get along with other people quite well, quite nicely. They are able to, make relationships, quite quickly. They are extrovert in their nature, in the sense that they are able to build positive relationships with individuals because they have a very good understanding of the values of person-centered care. And these values tend to be, again, going back to understanding what is empathy, what is, personal skills like patience, building trust, flexibility, a sense of humor. You would also look at honesty and have an ability to be able to solve problems. So these are all people-related skills that sometimes we call as interpersonal skills, and they are skills that you use to essentially communicate and interact with other people quite effectively. So these skills can be useful for you when you are looking at, understanding how to build positive relationships with individuals in a health and social care setting. Is that understood? Any questions on this so far? Okay, let's go across to the second criteria, which talks about explaining how health and social care workers can help promote individual individual's independence. Now here, one of the key things that we understood in the person-centered approach was to look at how can you promote independence within individual or a patient when they are receiving care. So when we talk about, this as an aspect, what we are looking at essentially talking about is that in general, when we look at promoting independence, we are looking at ways in which carers, health and social care workers can promote the individual to be more independent. And when we look at this as an aspect, what you're looking at is the individual being encouraged to do things as much as possible on their own. So if they can perform their tasks by themselves, if we can assist them only literally, in trickier bits, for example, in trickier tasks, and allow them and encourage them to do most of the other tasks themselves, then what we are trying to do is basically trying to promote the concept of independence. Now, the reason why promoting independence is quite important within health and social care setting and by a health and social care worker is basically to help the patient have confidence and control on their own situation. In some cases, this can lead to increased dependence. So what we don't want when we have individuals within the hospital or any sort of a social care setting, we don't want the individuals to stay there for long. So we want them to get better, get well, and then on their feet, and obviously, straight away out into the environment, into their general environment. So in this case, giving them more independence allows them to be more confident and allows them more control over their own decision-making process, their own well-being, and this allows them to basically become more independent, to be able to do things on their own. Now, when we look at the concept of why this is an important part in promoting important parts within the health and social care workers' role, is because this would help you in assessing, for example, independence and their abilities of the patient. So by doing a thorough assessment, you are going to be able to look at, I would say, assess individual capabilities. And these capabilities would then allow you to determine whether the person requires emotional support, physical support, or does it require, more of motivation to be able to start doing things on their own. Promoting independence from a health and social care perspective would also include that you are trying to set goals for the individual. And these goals that you're going to set for the individual will encourage them primarily to actively participate and be responsible for their own care plan. And these goals that you're going to help set up or help firm up would be realistic and achievable, thereby enabling the person to become more independent over a point in time. You could also be looking at providing education and training. In some cases, when you look at people recovering from surgery, they are given physiotherapy sessions, and these sessions are primarily, aimed at, obviously helping the individual get back on their feet or, start to do their own tasks independently. And this involves the physiotherapist teaching them, giving them training and education on how to do these things again, because they might have had a prolonged surgery, they might have been bedridden, and in some cases, they would need assistance or use of assistive devices like a walker, for example, or to get back some sort of muscular activity, they would need, help. And this is where, again, the individual will be working with them to train them, provide them information through education and training to help that individual become more independent. Now, when we look at decision-making as a process, again, this is related to independence. So think of qualities and attributes of the person-centered values which are important and how they would help the individual become more independent. So decision-making as a process, when the individual needs to do, if you give them information, and you provide them information and guidance which is related to help them do their daily chores and their function, then you are enabling them to basically make choices on the basis of their preference and abilities. And this is again going to promote independence in terms of individuals' independence from a point of view of you providing them information. Now, sometimes if you've had a surgery, if you had, say, for example, an accident and you have broken bones and you have a fracture and you have a plaster. So in some cases, you might need adaptations or assistive devices, for example, crutches, walkers, wheelchair for a certain point in time to be able to do some of your functions independently. So identification of what is required, and things like if you are on a wheelchair, then adaptation in terms of a say a ramp or some sort of grabbing bar or a tool to help you look at mobility or providing mobility aids. They would be a part and parcel of helping the individual become independent by ensuring that these adaptations and assistive devices are also made available. Now, there could be lots of different situations that you think of in terms of making sure that you are providing the right amount of support through maybe care, through emotional support, through advocacy, through assistive devices, through education and training, or to help set goals. And they would all be looking at promoting independence of the individual. So here in the video that we looked at earlier, how the care home is looking at promoting independence with Annie, who wants to make a cup of tea on her own to make sure that the environment is safe, and that allows her to get on with some of the things that she has been doing for years and years. And she feels independent in making a cup of tea on her own. So these things have to be done and understood as a health and social care worker so that you are able to promote independence. And in this assessment criteria, you would need to give an example of how independence can be promoted by a health and social care worker in a particular health and social care setting. So that's why I've taken this example in a video of the care home. Any questions on this so far? Okay, now, if we go across to criteria 3.3, here it talks about describe situations where health and social care workers can ensure privacy and dignity of individuals. So again, we need to think, put our thinking hat on, and we need to think of a situation in which how would you, when you're working as a health and social care worker, promote privacy and dignity of an individual. Now, these are again two important values that we see of person-centered approach, dignity and privacy. So just to refresh, what is privacy? You're giving people their space and you're respecting them if they have information which they want to keep it confidential. And that is where the disclosure of this information can only be done cannot be done without their prior notice or prior consent. So sometimes when you look at prescriptions, sometimes when you look at situations, the nurse or the practitioner would essentially speak to the patient first, say that, are you happy and are you comfortable with this? If I share this with your family or your friends, if this information can be shared with them, which will help you, provide maybe a better, help us make a better care plan, because we need the help and support of your near dear ones or friends and family. So in this case, your privacy is being respected by the health and social care worker because they're checking with you first to be able to discuss and disclose any sort of information. And when we talk about dignity, what we are doing is basically respecting their values and respecting the individuals in terms of ensuring that their wishes or their preferences are taken into account, and that would be basically looking at dignity. Now, how can we ensure that dignity and privacy are not compromised and they are maintained? So I've done up a small table here, which basically tells where we need to maintain privacy and dignity and what situation essentially causes, compromise of privacy and dignity. So when we look at somebody in a general ward, as an example, and if they are looking at changing clothes, or if there is coming in, if a doctor is coming in to, take a closer look at a particular thing, then normally what they will do is they'll pull the curtains around the patient's area, and that would ensure that their privacy and dignity are maintained, because that could mean that in general, they will not feel comfortable if they are feeling exposed, or if other patients are able to see what the doctor is talking or is inspecting. And in those cases, you would generally see curtains being pulled over, and that is maintaining privacy and dignity of the individual. In some cases, you would see the doctor might take or request the patient to come into a private consultation room, wherein again there is privacy, and that allows a one-on-one discussion to happen without having any information being disclosed or divulged to other people or patients, relatives around when this is happening. So if we look at not sharing the information of the individual without taking consent, ensuring that any inspection or any discussion between the doctor and the patient happens within a particular room or in a space wherein they feel that their privacy is maintained, and sometimes taking consent and approval before starting any inspection or before starting any medication or before applying anything, that would ensure that you're trying to maintain the privacy and dignity of the individual that you're providing for in terms of care. So this would be one such way as an example that you would look at in terms of how privacy and dignity should be maintained and should not be compromised. When we talk about confidentiality, when we talk about personal care, when we talk about personal space, when we talk about shared spaces, we talk about consent, and we talk about handling personal belongings, they will all be situations related to ensuring that you're trying to maintain the privacy and dignity of the individual. Is that okay? So you could take up any example related to handling personal belongings, taking consent, looking at the personal space, looking at personal care when you are providing. They would all be examples of how you would maintain privacy and dignity of an individual when providing care to the patient. Any questions on this so far? Okay. Now, the last assessment criteria talks about ethical issues that we need to look at in terms of how do we apply person-centered approach, within a health and social care setting. So when we talk about assessing ethical issues, what we are looking at is that we are going to try and apply the person-centered approach in a healthcare setting that involves taking into account individuals' values, preferences, and needs, and they become the central focus of care. So values, preferences, and need become the central focus of care, and they would be, as long as you're taking care of that, you are not going to be encountering any ethical issues. So when we look at generally providing, taking into account values, preferences, and needs, what we are looking at is that there are several ethical considerations that we are taking into account to ensure that the person's care that the person that we are providing care to is being done using the person-centered approach, or PCA. So when we talk about ethical ways of working, we are looking at understanding the basic values and principles that underpin a particular practice. For example, certain policies and procedures which are required to be observed, which would include things like respecting the privacy, confidentiality. In some cases, when you look at ethical issues, would be like nurses or practitioners will always change the gloves, they will change the PPE when they are going to a patient's room. They will make sure that they are using the hand wash or disinfectant to be able to ensure that there is no transmission of infection which can happen. And these are things which are going to be related to looking at ethical issues. Now, there are other examples that we can talk about, which is end of life issues, looking at relationships. You would be, because it talks about assessing, you would need to take an example. So we have to talk about the theory part of it. What are ethical issues? What are the approaches? We need to talk about what these involved in terms of working, and then taking an example to assess this particular task is going to be required. So when we talk about ethical theories in terms of ethical issues, we have had lots of different theories which have been described over the years. One of them is consequentialism, the other is deontology, third is principalism, and the fourth is virtue of ethics. Now, this is to understand what is the background behind ethical issues when they are faced within the health and social care setting. So when we talk about things then wherein there is difficulty in terms of dealing with this situation, what should we do? Is this the right approach? Is this the correct decision? Then in those cases, we are faced with what are called ethical dilemmas. Should we provide this medication? Should we look at this particular process? Should we look at taking this route? They would, kind of provide ethical dilemmas which practitioners have to deal with. And these have been described over the years by, individual theories which have been based on life experiences. So and what I've done is to explain these theories, I've created one slide in a bit of detail to help you understand what the theory is all about, when it was developed, when it was proposed, and in some cases, how it can be put to practice. So when we talk about consequentialism, this was initially proposed in the early 17th century, and the theory basically looks at what is the correct moral response related to an outcome, what would be the right response or right action to take if you're faced with this particular situation. So sometimes patients, if they are critically ill and they need expensive treatment, but they have low expectancy in terms of survival rates, then should the operations or resources or other bits should be spent or not is the dilemma or the questions which are normally answered by this theory. Now we look at deontology, and this was again proposed in the early 17th century. This was looking at the theory proposing that we should stick to our obligations and duties of a person, and these duties and obligations that we have should be helping us make a correct decision or making an ethical decision. Now, if the duties and obligations are not focused on the outcomes or the actions which the theory would help provide, then in this case, the patient could be put into harm's way. So this theory takes into account the aspect of that we need to be looking at sticking to our obligations and duties to a person or a society, and these decisions should be looking at these duties and decisions that we take or obligations that we perform should help us in let's say making the correct decisions. When we talk about principalism, this was initially proposed by Tom Beauchamp and James Childress. Now this theory looks at 4 ethical practices. It talks about autonomy, it talks about beneficence, and talks about non-maleficence and justice. So these are 4 aspects of principalism. So here the theory explains that when we look at making decisions, we need to be able to make decisions which are going to be independent, but also be able, we need to be able to provide information to the patient who will then make independent decisions based on the choices that you're provided. Beneficence tends to be balancing the benefits of treatment against the risk and costs which are involved. So sometimes when treatments are given, there are risks associated with it, there are costs associated with it. So what we need to be able to look at is we need to be able to look at providing the benefits of the treatment and the risks which are associated with the treatment, so that the patient is able to then take a calculated decision whether this is something that they would want to go for or not go for. Non-maleficence tends to be that all the care, all of the care and obviously procedures, processes being performed should not be harming the individual or the patient. So they should be avoiding any cause of harm. They should not have any side effects or any harm that can be done or come out of treatment. And these principles, along with justice, that means you need to be morally just, fair, and ensuring that these treatments and remedies which you are offering to the patient actually are going to be respecting and helping the patient to get better, have to be looked at. And that is the whole essence of principalism. The last talks about virtue and ethics. So in this theory, essentially going back, it talks about that if you're a health and social care professional, you need to be making decisions on the basis of morals, what you feel right and what you feel would be right for the patients and your colleagues. So in this case, sometimes the treatment that you provide needs to be done at the right time, at the right place, so that they can, when I say they, I mean patients can gain or get the maximum benefit out of it. So sometimes you have to look at, medics and practitioners treating patients, in locations wherein they feel that, they are going to be able to do this at the right place at the right time. And that as a principle needs to be applied. So when we talk about assessing the ethical issues involved, we are looking into autonomy, we're looking at balancing individual preferences, we're looking at resource allocation, we are looking at confidentiality and privacy, we are looking at their cultural background and differences and diversity, and we are looking at communication, transparency, and accountability. And this is what tends to be the ethical issues that would be addressed by looking into these 4 different theoretical approaches that can be applied when we talk about person-centered approach. So here again, you would need to look at taking an example of how overall person-centered approach in healthcare requires very careful attention of ethical issues to ensure that individuals are respected and they are involved in their own care planning and receive the appropriate care and treatment which will allow them to get better or obviously get well soon. And that is what needs to be looked at by addressing ethical issues related to person-centered approach. So any questions on this assessment criteria so far? Right. So if there are no questions, then we come to the end of today's session, wherein we have comprehensively discussed how do we look at applying person-centered approach in health and social care setting. So you need to understand what are health and social care settings, which is health environments, social care environments, childcare environments, working in partnership, and obviously helping to work when we look at private-public partnerships, looking at building positive relationships with the patient. And they would then help you deliver care within a particular setting to the patient who's receiving, treatment or any sort of care for getting, against, say, for example, a backdrop in terms of either, a surgery or maybe recovering from an accident or from an illness. And that would involve, understanding the health and social care setting in which you're going to be providing care using the person-centered approach. Is that okay? Any questions on this today? Anybody for those who have joined, any questions? Right. Now, in addition to this, to understand this particular learning outcome and obviously, discuss maybe some of these in a bit more detail that we have covered, what I would want you to look at would be a bit of a handout on Moodle. And that handout on Moodle, which is covering learning outcome 3, would allow you to build onto what we've discussed in today's session. So if I go into the Moodle and, show you the handout that you need to be able to go through after this session, and the Word document that I've shared, predominantly for the purposes of, doing your own audit, for the purposes of your own audit for, health and social care, so personal skills is going to be important. So let me just switch you over to Moodle. So if you look at this, today's learning outcome, the presentation slides are here. There's a bit of a handout that I've uploaded to cover the merit section, which is dementia. What is the ethical approach when you're dealing with people having dementia? So this is a specific example which talks about how person-centered approach and ethical issues to be taken into account when you're dealing with people who have dementia. So a good read of half an hour, but it'll explain in a great amount of detail what are the ethical issues faced by health and social care professionals when you're dealing with somebody who has dementia. Now, the other bit which I would ask you to look at would be, going through the presentation slide and then using this particular handout which I've provided to discuss what are person-centered values. This handout is given here, which is labeled as 1.1. But you can use, if you've used this in your task and criteria 1.1, you can actually now relate to your personal skills by adding a column. And that would be, if I briefly show this, what I would want to do. So this will be a downloadable document that you can download as a Word document. So if I download this document and then show you what you need to do, that would be helpful for you to understand the assessment criteria 3.1. So if this was the document which was, the first document, what I would do is basically insert, a column on the right, And what you would need to do here is write your personal skills. So define these are the values which are person-centered values. Define them very briefly. This document, can expand if you press enter, and then write what is the personal skill that you have to, relate to the person-centered value which you're talking about. And that would be, useful for you from a point of view of covering 3.1. Is that okay?
Excuse me, Raman.
Yeah, go ahead.
But do you have to fill all these?
Yes, so there is a document that I've sent you on WhatsApp, which is this document. And my suggestion would be to use this document to fill it. And that would become a part and parcel of your task 3.1 when you do it later as an assignment.
Do you have to fill it before the deadline or?
No, you can do it later as well. But the idea would be to try and do it as you've studied the learning outcome today, you're fresh, and it would be useful for you now to fill it up rather than leave it for later.
And send it separate.
Yeah, no, don't send it separate. Just keep it with you and then send it along with the assignment when you're doing it.
All right.
Is that okay? So
Yeah.
this bit is 1.1, and the personal skills and qualities that you need is basically, 3.1. Personal skills and qualities. So I will upload this document, on a Moodle, and you should be able to see it, and then obviously use it for the purposes of, refreshing and revising what we have discussed today. Any other questions? Anybody else at this stage? Okay, no worries. So take